Hundreds of people in Chile have protested against a government measure for a return to work despite the ongoing coronavirus pandemic. China has again rejected what it considers are conspiracy theories and false accusations by the United States regarding the origin of the novel coronavirus. Muslims across the world are preparing for the traditions of the month of Ramadan in the midst of lockdowns. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Hundreds of people in Chile have protested against the measure for a return to work announced by the government. The protesters concentrated in Baquedano Plaza in the Chilean capital to reject the measure named New Normality announced by the Sebastián Piñera government. The regulations outline the gradual return of over 100,000 state employees to their workplaces, despite the fact that the World Health Organization has reiterated the continued risk of the spread of the coronavirus. During the demonstration, at least 10 people were detained by police who used water cannons to disperse protesters. The Vice President of Chile's National Association of Fiscal Employees, Carlos Insa, in an interview with our Spanish channel program Es Noticia, discussed democracy in Chile under the coronavirus lockdown. Let's hear what he had to say.
This state of catastrophe, which is a constitutional state of exception, and is a reasonable measure when you have a government with the will to concentrate its efforts on controlling the pandemic, has in effect been transformed into a state that reverts to repressive measures regarding demonstrations, regarding mobilization, union action, and regarding protests due to the complex social and economic consequences of the quarantine period. Today, we can clearly say that the measures the government has developed do not yet generate any kind of economic support for informal workers, for the most vulnerable workers of the country, and those families of the most vulnerable sectors of Chilean society. We are talking about a very complex situation in which the anti-democratic bases of the Chilean constitutional framework are expressing themselves with all clarity, and the deficiencies of the neoliberal model that has been implemented over 40 years become increasingly evident.
The Engineers for Brazilian Democracy group has filed a complaint against President Jair Bolsonaro before the International Criminal Court for genocide and crimes against humanity over his mishandling of the coronavirus pandemic. This is the second criminal complaint filed against Bolsonaro before The Hague. The group stressed that the Brazilian president had violated the confinement recommendations of the Ministry of Health and the World Health Organization. The complaint was filed after Bolsonaro met with his supporters in a public rally, greeting attendees despite allegations that he could be infected with COVID-19. The lawsuit also refers to Bolsonaro's numerous acts to encourage gatherings of people without using protective equipment and calling for normality despite the rising number of cases and fatalities in the country. And as Brazil reports over 40,800 confirmed COVID-19 cases and almost 2,600 deaths, the country's new health minister said on Monday that the government will increase coronavirus testing capacity and that will gradually lift social isolation measures. Meanwhile, the country's health system is collapsing. Our correspondent Brian Meir brings us the details.
Last week, health authorities in Amazonas, which is the Brazilian state with the highest number of per capita coronavirus patients, announced that their ICU units in the public hospital system were overflowing. And from that point on, anyone who needed to get on to a respirator had to wait for someone either to recover from coronavirus or die who was in the ICU ward. Now, two more Brazilian states have announced that they're in the same situation. Ceará and Pernambuco, which are two states in the impoverished northeast, have both announced that their ICU wards are completely full due to the coronavirus outbreak. Now, Brazil has 26 states, plus the federal district of Brasilia, and each one has their own public health system. They have a lot of autonomy on how to use their resources that come from the federal government every year. But the fact of the matter is, although some states are doing much better, the numbers keep increasing. Last week in Sao Paulo, which is the state that's hardest hit in the total numbers of coronavirus patients, announced that their ICU wards were 70% full. And only a week has passed and the number's already gone up to 80%.
Colombia is close to reaching 4,000 COVID-19 cases, while almost 190 people have lost their lives so far. On Monday, President Ivan Duque extended lockdown regulations until May 11th. The National Institute of Health revealed that as of Sunday, 4.25% of the novel coronavirus cases in Colombia are health workers, most of them infected while working on the front line against the pandemic. Meanwhile, doctors continue to conduct searches for suspected COVID-19 cases in Colombian neighbourhoods. The Ministry of Health and Social Protection stressed on Monday that over 73% of cases are people aged between 20 and 59, although more than 50% of fatalities are patients aged between 60 and 79. In the Mexican town of Santa Maria Jaljalpa, a community of some 6,000 residents about 80 kilometers from Mexico City, special vouchers have been handed out to help pay for food in certain stores as a means to support people who have no income as a result of the coronavirus lockdown.
The Jaljalpesos were designed. The idea came up from the three of us to, well, why don't we create a voucher with symbols of the community? We talked to the market stand sellers out there, with a poultry shop owner, a tortilla stand owner there, and we proposed the idea and they told us, perfect, it would help us because we are no longer selling, so it was a win-win.
It's good now that we don't have any money because this is a relief that they support us.
Jamaica will keep its borders closed until May 31st, as the country has reported 27 new COVID-19 cases in 24 hours, taking a total to 223.
The government has also taken some other measures, which the Minister of Local Government had announced earlier. Golden age homes, infirmaries, there are certain orders that relate to them. Those orders still remain in place, particularly about visiting and how workers should operate and the hygiene measures that are necessary. So we want to make sure strategy number one is to protect our elderly. So far, knock on wood, we have done fairly well in protecting the elderly population.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. China again rejected what it considers are conspiracy theories and false accusations by the United States on the origin of the novel coronavirus. President Donald Trump insists on fueling this rhetoric at a time when experts warn about the need for unprecedented international cooperation to tackle the COVID-19 pandemic. More in the following report.
China is a victim, not an accomplice of COVID-19, stressed Chinese Foreign Ministry spokesperson Zheng Xuan on responding to the latest accusations by U.S. President Donald Trump on the origin of the novel coronavirus.
The virus is a common enemy for all humankind and may strike anytime, anywhere. Like other countries, China is also a victim, not a predator, even less an accomplice of COVID-19.
China and the international community have constantly rejected the conspiracy theories and accusations regarding the origin of this pathogen leveled by Washington without any scientific evidence and with a clear political bias.
U.S. Senator Tom Cotton said the virus came from the Wuhan Virology Institute. Then, the Washington Post and another two reporters wrote an article saying the virus came from the Wuhan lab. They don't have any evidence, nor can they establish any logical link to make such statements. They were completely based on speculation. There isn't a single shred of evidence showing the virus is man-made or synthetic.
Beijing criticized the double standards of some Western politicians and media and recalled that in the past, no one asked the United States, for example, to apologize or take responsibility for previous crises.
In the face of major public health crises and infectious diseases, the international community should stand in solidarity and work together. instead of resorting to mutual accusations or demanding retribution and accountability. I don't recall anything like this in recent history. The H1N1 flu broke out in the United States and spread to more than 214 countries and regions in 2009, resulting in nearly 200,000 deaths. Has anyone asked the US side to compensate? In the 1980s, AIDS was the first discovered in the United States and spread to the world. Has anyone sought that the United States take responsibility for this?
The COVID-19 pandemic has claimed the lives of 170,000 people around the world, the majority of them in the United States. Conservative media and President Trump continue to speculate on the origin of the coronavirus and blame China. This narrative, according to experts, does nothing to help save lives. Instead, it diverts attention from the gross mismanagement of the outbreak by the United States current administration.
US President Donald Trump said Monday he will sign an executive order to temporarily suspend immigration into the United States due to the coronavirus pandemic. Trump offered no details as to what immigration programs might be affected by the order, while the White House did not immediately elaborate on Trump's tweeted announcement. The US president has taken credit for the restrictions on travel from China and hard-hit European countries, arguing that these contributed to slowing the spread of the virus in the US. Almost all visa processing by the State Department, including immigrant visas, has been suspended for weeks. The United States has now reported more than 804,000 confirmed cases and over 43,000 fatalities. With over 816,000 confirmed coronavirus cases, the United States continues to be the country hardest hit by the pandemic. Our correspondent Jorge Gestoso brings us the latest on the situation there.
Thank you. The cases of coronavirus has already surpassed 800,000 in the US, and the deaths are getting very close to 45,000. So the pandemic is still not under control. And most definitely, that is creating a lot of question marks. For example, 3 states, we're talking Mississippi, we're talking Georgia and South Carolina, are reopening their economy very soon. We're talking, in case of Georgia, by Friday, they're going to do it in stages, which is creating a lot of question marks of what if the new cases are going to show up, if it's not going to be more complicated that start to fight the virus since the very beginning. At the same time, we have seen that in at least half of states, there are hospitals that are cutting the salaries, the payroll of emergency doctors by 40%, and the argument is that they are losing money because that is, of course, private hospitals with for-profit organizations, because they're saying that because they're not practicing, they're not performing surgeries as much as they do regularly, that is exactly in that area that they make the money. Now they are being obliged, quote unquote, to cut the salary of the very key people fighting the pandemic. We're talking about the doctors in the emergency room by 40%, and the Association of Doctors say that that could even represent the closing of some emergency rooms. In terms of the economy, the slowdown of the economy, we're talking that being at home means that people are not consuming. Because they're not consuming, they are not producing. Because it's not being produced, there's no need for oil. So the prices of the oil in the US for the second day in a row plummeted again and was dragging the stock market again for the second day also in a row in a free fall. We get back to you now.
Japanese medics are warning more must be done to prevent the coronavirus from overwhelming the country's healthcare system as the number of confirmed cases passed 10,000. Meanwhile, Japanese Prime Minister Shinzo Abe expressed concerns about the lack of social distancing under a state of emergency he declared 2 weeks ago to step up measures against the COVID-19 virus.
We have had cooperation in reducing human-to-human contact, with an aim to reduce this by at least 70%, as much as possible 80%. However, in some regions, this is still insufficient. We ask for further cooperation in working remotely and other measures. There is already a cumulative 10,000 cases. The medical situation on the ground is under pressure. To relieve this pressure, if even by a little, and to protect your own lives and health, we'd like you to refrain from going out.
About 800 doctors and nurses from several frontline hospitals across Vietnam will participate in a tuberculosis vaccine trial against COVID-19. The director of the Central Lung Hospital in Hanoi, Dr. Nguyen Viet Nhang, said on Monday his hospital has sought Ministry of Health approval for a trial to find out if the tuberculosis vaccine could mitigate the level of lung damage in COVID-19 patients. It would also compare the symptoms vaccinated patients have with those of other groups, he explained. The vaccine has already been tested on some COVID-19 patients and people who had come into close contact with them, but the results have not yet been studied. Vietnam has reported a total of 268 positive COVID-19 cases, of which over 200 patients have recovered. The country has not reported any new cases for 5 days now. And we're taking one last break now, but stay with us for more. Welcome back to From the South. Indonesian President Joko Widodo on Tuesday banned residents in the Muslim-majority country from returning to their hometowns to celebrate the Islamic holiday of Ramadan due to the coronavirus pandemic. The announcement came amid fears from health experts that Indonesia could face an explosion of coronavirus cases, which could reach more than 1 million people after Ramadan. Last year, some 33 million Indonesians left cities to visit relatives during this holiday. President Widodo said government surveys showed 24% of the population was still intending to travel home, which led him to issue the ban, while he called on his administration to prepare measures to enforce the restriction. As of Tuesday, Indonesia had reported over 7,000 coronavirus cases and more than 600 deaths.
Saya ingin mengambil sebuah keputusan.
I want to make a decision. After imposing a mudik ban for all government employee, military and police personnel, including employees of state-owned enterprises last week, on today's meeting, I would like to announce that mudik will be banned for all.
Mudik semuanya akan kita larang.
Iraqi authorities partially scaled back the 24-hour curfew imposed to contain the coronavirus on Tuesday in a move to balance the restrictions with the traditions of the month of Ramadan. The new partial curfew will be implemented from 7 p.m. to 6 a.m. as of April 23rd and until May 11th. However, a total curfew will remain in place on Fridays and Saturdays, while restrictions on public gatherings and social distancing rules continue. Ramadan, which begins this Thursday, is the 9th month of the Islamic calendar, during which Muslims fast from dawn to dusk. The partial lifting of the 24-hour curfew will give Baghdad residents a window to make their final purchases ahead of the start of the holy month. The Iraqi Health Ministry has confirmed over 1,000 cases of the coronavirus and 82 deaths.
Today we are happy with the bold decision taken by the crisis cell to implement a partial removal of the curfew enforced on the Iraqi people, especially the poor and day laborers who struggled during lockdown. But at the same time, I hope Iraqis will be vigilant and should abide to all protective measures and instructions announced by the Ministry of Health and inspection teams.
Drones are being trialled in Ghana as a solution for speeding up the delivery of samples to be tested for the novel coronavirus, helping the government monitor its spread in more rural areas of the country. The initiative had begun delivering virus test samples from outlying areas back to Ghana's capital, Accra, drastically cutting down the time it takes for health workers to receive test results. Drones now can fly test samples collected from patients in more than 1,000 health facilities located in difficult-to-reach rural areas of Ghana. The test samples are packaged in accordance with the World Health Organization's guidelines, and drone operators wear protective gear while handling the sample containers. Ghana has reported 1,042 confirmed cases and 9 deaths. And the number of confirmed COVID-19 cases in the African continent has reached 24,400 as countries continue to adopt measures to stop the spread of the virus. More than 6,000 people have recovered from the COVID-19 virus, while almost the same number have died. As of Tuesday, Egypt surpassed South Africa as the most affected country in the region, with over 3,400 positive cases and 264 fatalities. South Africa follows with 58 deaths and more than 3,000 confirmed cases. Toques de Rio is a young Cuban band that promotes the fusion of different traditional Cuban and international rhythms, including conga, reggae and samba. They've joined initiatives to encourage people to stay home in the midst of the coronavirus pandemic, while also offering their music to their fans. And we finished this news brief with a video by the popular band. Remember, you can find all the latest news on our website, as well as on our social media pages. For Telesur English, I'm Katrina Goss. Thank you for watching and enjoy the music.
Sean disciplinados y tomen conciencia. La medida más importante que debemos tomar es quedarnos en casa.
Escuchando música, bailando, cantando, haciendo cosas lindas, pasándola bien con la familia.
Que muchas veces el tiempo es tan poco para poder hacerlo.
Cree su tiempo en algo positivo.
Siguiendo este proceso creativo para que usted, cuando todo esto pase, pueda seguir disfrutando de la música de Toques de Río.
Quédate en casa, hazlo por ti y tus familiares. Ponle bomba a tu cuarentena.
Lo mejor deseo para ustedes es que se cuiden mucho, porque sin ustedes no somos nada, a ustedes nos debemos. Así que
ahora se ven grandes y espero podernos ver pronto. Dale música.
bien calentico, compra todo.